We think it's aligned, but we can obviously see why people might say, hey, it says there's a way that you don't have to mask, and if you're vaccinated, and California's requiring you to mask. For us, we have a plan, and I call it the all schools, all kids, all day in person in the fall plan, so that we get every California kid back to school. And with the level of uncertainty and frankly, our work in progress on getting young people vaccinated, starting the fall with all kids masking, plus emphasizing the need to do good ventilation in our schools, as well as having testing available, I think is going to be California's way to go. The CDC also talked about the need to, or the recommendation to have physical distancing. We know that in California that some schools aren't able to do that. We believe that the masking prevention strategies are really strong. And so we're not requiring schools to have physical distancing requirement because we are strengthening that mask requirement. And all of this is consistent with the CDC's idea that you layer these different prevention strategies to create a safe environment.
It makes sense. I know we had some school districts here that started reopening by the end of the school year, but within those districts, there were some schools that could reopen, some classrooms within those schools that could reopen, some that could not, because only some of those classrooms, some of those schools could accommodate the physical distancing, others could not. And so those schools and those classrooms didn't get to reopen. And that was something a lot of parents didn't understand. So now we know that regardless of if they can physically distance or not, those schools can reopen as long as the masks are on. But one of the things that I've been hearing from so many people is that well, kids don't get COVID. Kids don't get COVID. Kids aren't at high risk of COVID. Can you explain that, why we're still having the kids mask, what the risk is to the kids, these younger kids?
Well, as a father of four and a pediatrician, I can tell you kids can get COVID. Many have. Increasingly, kids get COVID because so many adults are not protected. So out of our cases, more and more are younger people who aren't vaccinated. It is true we have not seen kids get as sick as adults and have the same bad consequences adults have, but we're still learning the long-term impacts of COVID and its effect on your respiratory system, on your brain, on other aspects. And we have a pretty simple solution to prevent and reduce infections that we think is worth using. And by the way, when kids do get COVID, if they do, it takes them out of school. You have to isolate, their friends or contacts have to quarantine, and that means you miss out on one of the most valuable things that we want kids to get back to, which is in-person education.
Everybody, if there's one thing we agree on, it's that we want all the kids to get back to school. At this point, how soon do you think kids 12 and under will be able to get vaccinated? I know that's the big thing, that's our next, major milestone, one of the big ones anyway, coming up, hopefully.
Yeah, no, I mean, I like to think that it's probably earliest sometime in late September, but it may end up being closer to Thanksgiving. We're not sure. Some of the trials are still underway. The data and evidence is getting submitted to the FDA soon, and then hopefully it's a quick approval process. And we're seeing those younger than 12 Californians getting a chance to get vaccinated and protecting themselves.
Yeah, we got to speak actually with one girl who's part of the trials out here in Sacramento. It's very interesting, and it's interesting to see that work being done, especially here locally and in California. How will this be enforced, the masking in schools? And then, eventually when when kids 12 and under can be vaccinated, how is this going to be enforced in schools and supported?
Well, first off, we think that schools will take the recommendations and requirements. This is not just about masking. We have a lot of recommendations and ways to support a full, safe environment at schools. It includes masking. And so schools will take those requirements and those recommendations and implement them. And that's the state's expectation. We work with the local health jurisdictions, local school districts, and county offices of education to make sure there's no issues with implementing these. And in fact, Zach, we've heard positive information from a number of school administrators who say, thank you for letting us have the clarity. We know kids have to mask, we can implement that. We know we don't have to figure out distancing, which, as you said, some schools can't implement. So now we've given them a clear path to how all kids can come back. In just a few weeks, my kids start back in school in 4 weeks. I mean, not a lot of time to plan. So this simple, straightforward approach, I think is going to give us a chance to really get all those kids back.
You know, I keep hearing a lot about indoor masking. Forgive me if this is an ignorant question, but when kids go outside and stuff, what is the guidance in terms of that with the masking?
Thanks, Zach. We are talking about indoor masking. Outdoors, optional. Take them off, have fun, play, run around. We think that that's important. And we know that the indoor environment is so much higher risk than the outdoor environment. That fresh air, the little bit of wind, COVID doesn't break through it. We haven't seen a lot of infections or outdoor transmission, and that's, I think, good news. Especially now, Zach, with lower transmission rates than we saw this winter, that we believe that that is continuing to be a safe recommendation.
Yeah, it's huge for sure. And definitely a relief for some of those kids because I know, up here in Sacramento, as you know, we get very, very hot. And so sometimes that mask doesn't make it easier for the kids or the staff, even for that matter. One of the big things with masking and mask mandates and stuff, it's been politicized. And, that likely has been detrimental to what we saw in the last year and stuff in terms of numbers and cases. Do you have any concern that this masking confusion is going to fuel some anti-government, anti-science sentiment with the recall just, weeks and months away?
Well, I think about how we continue to be guided by the science and the data. So we're looking at the science and the effectiveness of masking and some of the other prevention strategies, and then also looking at the conditions in California. And sadly, Zach, we're seeing some increase in cases. The Sacramento area is seeing increase in cases. Most areas of California are seeing increases, in part because of the Delta variant. So these are things that we're concerned about. And so, everything in COVID has had a political edge to it. And we still try to lead with public health, have everything focused on the data, the science, and effective communication and messaging, and always hope that it doesn't get garbled up and lost in the political conversation, which in many ways has been unfortunate throughout this pandemic, but a reality that we've all gotten used to.
Yeah, unfortunately. And, you kind of touched on it, but how are we doing here in California in terms of the Delta strain? What can we expect in the next week, the coming weeks?
Well, I mean, like I said, cases are going up. And we are largely seeing cases in unvaccinated individuals. So if you ask me, what are a couple of things that we need to do in California? We need to continue working to get people who are willing to get vaccinated, make it convenient, answer their questions, and make it clear the benefits. Because right now, the vast majority of cases and almost all of the hospitalizations and deaths that are happening now are among unvaccinated people who have a chance to be vaccinated. So that is such a strong message, such a clear data-driven point that we want to make sure that gets out there. And then for those who aren't vaccinated and aren't planning to get vaccinated soon, if I can't change your mind on that decision, then I urge you to, consider where you're going. Indoors, very risky right now. Delta variant, very sticky, very infectious. Lots of people getting infected that thought they wouldn't get infected, doing the same thing as before. And so encouraging people to think twice about going unmasked indoors and adhering to that requirement if you're unvaccinated to mask inside places in California.
Absolutely. What kind of programs do we have, going on to really try to get the people who are unvaccinated, those holdouts, what do we have going on to push them to do that, to encourage them to be vaccinated?
Yeah, there's still certainly some cash and other sort of prize incentives, but mostly it's really talking to people and answering their questions. I know I do it a lot day in and day out, talking to individuals who just have a few questions, trying to debunk myths, share the data and information, never in a stronghold, you must do it way, because that never works. It's really, how do you, as I say, get down on your knee and really listen to people's concerns and try to give them information and make it convenient. So we're still doing a lot of that. There's a door-to-door campaign in many parts of the state. There continue to be what we call pop-up vaccination sites where You almost have to deliberately walk by it and ignore it in order not to see the message. So those are effective strategies, and knowing that we have to focus on some communities, largely communities of color, largely those same communities that were ravished by our winter surge, to encourage those individuals to get their questions answered and get vaccinated. So lots of work on this front, and grateful to Californians across the state doing this work day in and day out.
Yeah, so many great organizations helping out with that. We've spoken with them before, and great work is being done.
Yeah.
While we have you on the call right now, can you explain, help people kind of understand what's going on with boosters? We know that the CDC is saying, at this point, booster shots, not recommended, but then we see Pfizer, on the other hand, seeking approval from the FDA. From what I'm understanding, that's just to be ready in case that guidance changes and is updated. But can you kind of explain that for people?
Yeah, and so both of those things are right. The CDC is right in saying we haven't seen the evidence for a need for a booster now. Pfizer is right by saying, look, we're trying to prepare and be ready. So if you do need it, it doesn't take many more weeks or months to get it approved and through the process. That said, I sort of simplified. There are going to be two reasons why we might need a booster. One is what we call waning immunity, or the response from the first vaccine or two doses, if you got Pfizer and Moderna, starts to get reduced. We see that all the time in kids' vaccines. We have to give you an extra shot. You got two when you were 4, and then why do you need another one when you're 10? It's because you need to get that boost of your immune system. So that's a very common reason. The other reason is we may see a variant that doesn't respond or can break through the vaccine. So you might get an additional shot in that case because we figure out how to protect against that new variant. So those are two different reasons. We watch very closely on both. And if one of those reasons actually becomes unfortunately true, then we will work to make sure Californians, as soon as it's approved, have access to that booster to keep us protected, not just individuals, but our communities at large.
Yeah, getting a head start if we can. What new guidelines, this week can we expect, if any?
Well, California will come out maybe, soon, before the middle of the week, with our, clearly stated school guidelines for the fall. And this should really build on what we've talked about today and clarify for school administrators, students, families, what to expect. But then top line is, we believe we have a path for all kids to get back in person safely in just a handful of weeks. No matter what happens with transmission, no matter what happens with the Delta variant, we believe we have a path to get there. And that, for myself and many, many other parents and family members and students, is great, great news.
Absolutely. And I don't have any school age kids or people in my orbit right now. So when you say it's only weeks away, that shocked me. It hit me right now. I'm like, wow, there really isn't that much time. I forget that the summer is just flying by and their kids are going to be back in school very soon. So definitely timely topics. We thank you so much. Anything else you want to add? This isn't a trick question or anything. Just want to make sure we get everything out there.
Yeah, no, I think you hit it. I think the message around vaccination, it is the key tool. We focus on masking, we focus on testing, but the number one thing we can do to keep this virus in check is get people vaccinated. So if you're inclined, and this is the week for you to do it, thank you very much for taking that opportunity.